All right, let's jump right in. Today we're looking into this lawsuit that the Kansas Attorney General Chris Kobach has filed against Pfizer, all about their COVID-19 vaccine.
Yeah, this one's it's interesting.
Yeah, we've got like a whole bunch of stuff to go through. We've got court filings, some news articles, even a YouTube discussion from Valuetainment.
Oh, wow.
So it should be a pretty interesting deep dive. We're basically trying to figure out what this lawsuit is really all about.
Yeah.
What are the main arguments? So let's get into it. It seems like Kansas is basically saying that Pfizer kind of pulled a bait and switch, like they weren't totally honest with the public about how safe and effective the vaccine was, especially for pregnant women and people with heart conditions.
Right, and Kobach's really focusing on this idea that Pfizer wasn't transparent enough. Like they knew about some potential risks, but they downplayed them, especially for these more vulnerable groups.
Yeah, and he even brings up this Pfizer report that shows like over 50% of pregnant women who got the vaccine, they reported having like bad side effects. He even says over 10% of them had miscarriages. That's pretty serious stuff.
Yeah, that's a big claim. But of course, Pfizer's come out and completely denied all this. They're saying their vaccine is totally safe and effective, and they're talking about all the lives they saved.
Yeah, of course. But that kind of makes you wonder, like, if they're so confident, why even bother suing? They could just ignore it, right?
Yeah, well, it seems like they're taking this pretty seriously. They're fighting back hard, probably because they see this as like a threat to their whole reputation. And, it could set a precedent for other lawsuits down the line.
Makes sense. So let's break this down a little bit. First up, let's look at the stuff about pregnant women.
Okay, so Kobach's main point here is that Pfizer knew or should have known that there could be problems during pregnancy, but they didn't really warn people about it.
Right. And he keeps pointing to that internal Pfizer data that apparently shows these really high rates of side effects and miscarriages.
Yeah.
But I'm sure Pfizer has a response to that, right? Like, weren't they working with like limited information at the beginning of the whole vaccine rollout?
Yeah, that's a big part of their defense. They're saying they were just acting on the best information they had at the time and that they updated their guidance as they learned more.
Right. So it's kind of like a question of what did they know and when did they know it? Actually, the valuetainment discussion we have talks about this too. They suggest that Pfizer might have had even more data than they let on, especially from studies on animals.
Yeah, the host specifically mentions studies on rats. They say the vaccine could be linked to things like infertility and problems with the baby rats. But, we gotta make it clear this is just one perspective, not necessarily a proven fact.
For sure. Yeah. It's important for everyone to understand that we're not saying any of this is definitely true or false. We're just laying it all out there, the claims, the defenses, the different opinions floating around.
Right, we're just giving you the information so you can form your own opinion.
Exactly. So that's the pregnant women piece. What else does Kobach have against Pfizer?
Well, he also goes after them for how they dealt with heart conditions, specifically myocarditis, that's inflammation of the heart muscle.
Hmm.
He says Pfizer had evidence linking their vaccine to myocarditis, but they basically downplayed it or even denied it.
Oh, yeah. Didn't Pfizer CEO Albert Bourla publicly say that there wasn't any evidence linking the vaccine and myocarditis?
Yeah, and Kobach's using that statement against them. He's saying Pfizer actually had data that contradicted what Borla was saying, and they didn't share it with the public.
Hold on a second. Is that even legal? I thought there were some protections for pharmaceutical companies, especially during like a health emergency.
Yeah, you're right. There are some legal protections. Pfizer has immunity under this program called CICP. It was made to protect companies from lawsuits when they're developing treatments and vaccines during a health crisis. But there's a catch.
Yeah, that's the catch.
Well, that immunity doesn't apply if there's proof of something called willful misconduct. That means the company, intentionally did something to cause harm, and they knew, or should have known, that their actions would hurt people.
So Kobach is basically trying to prove that Pfizer wasn't just careless, they were purposely misleading everyone. That sounds really hard to prove legally.
It's definitely a tough legal challenge. Kobach has to convince the court that Pfizer intentionally acted in a way that caused harm, even though they knew the risks.
Right. So what does the valuetainment discussion say about this whole willful misconduct thing?
Well, it's interesting. The valuetainment host talks about the idea that maybe Pfizer was part of this bigger plan to create the problem, sell the solution. They're implying that maybe there was some deliberate manipulation going on for profit. Again, we have to say, this is just a theory, not a proven fact.
Of course, we're not endorsing this view. But it's out there, and it's important for people to understand the full picture, even the controversial stuff.
Right. It's all about getting a 360-degree view, not just one side of the story.
Exactly. So we talked about Kobach's claims about pregnant women and myocarditis.
Hmm.
What else is he going after Pfizer for?
Well, he's also challenging their claims about how well the vaccine worked against the new variants and its ability to prevent transmission. He says Pfizer overstated the vaccine's effectiveness, especially against the new variants.
I remember all the early data looked really good, though. Everyone was optimistic about the vaccine stopping the spread.
You're right, there was a lot of hope at the beginning, but then new variants popped up, and the real-world data started showing that the vaccine's effectiveness against infection and transmission, it kind of went down over time.
So Kobach is saying that Pfizer knew this was happening, but they kept telling everyone that the vaccine was a surefire way to stop COVID.
Yeah, that's pretty much his argument. He's alleging that they prioritized making money over giving people accurate information, which could have misled the public.
It's like a battle of stories here. Pfizer says they were responsible and followed the science, while Kobach says they were deliberately deceiving people and didn't care about public safety.
Yeah, you got it. And this battle's happening not just in court, but also in the public eye.
And that brings us back to that valuetainment discussion. They really dive deep into Pfizer's possible motives and even suggest they might have downplayed the risks just to make more money. This whole create the problem, sell the solution idea is a bit out there, but it is interesting to think about.
It definitely raises questions about how much influence pharmaceutical companies have and if there are any conflicts of interest, especially during a big health crisis.
Okay, so we covered a lot in this first part. We looked at the details of Kobach's lawsuit and talked about trust, transparency, and potential conflicts of interest. So what's next?
Well, in the next part, we're going to get into the potential consequences of this case. What could happen if Kobach wins? How will it affect how we develop vaccines in the future? How will this impact public trust in drug companies and health organizations? And what does all this mean for society as a whole?
Well,
Lots to discuss.
for sure, yeah. A lot to unpack there. Stay tuned for part 2 of our deep dive into the Kansas lawsuit against Pfizer.
All right, so we're back. And we've just started digging into this lawsuit, but it's already clear it's a lot bigger than just Pfizer.
It really feels like there's this clash of, like, ideologies going on, you know? Like, on the one hand, you have this pandemic and everyone needs to act fast, but then on the other hand, there's these concerns about whether companies are being transparent and whether they're overstepping their boundaries.
Yeah, it's like, how do we balance the need to find solutions quickly with the need to make sure everything's being done properly, especially when people's lives are at stake?
Right. And the stakes are even higher when you think about the long-term consequences of all this.
Yeah.
So let's talk about those. Like, what could happen if Kobach actually wins this thing? What did it mean for, like, how we develop vaccines in the future?
Well, if Kobach wins, it could give other states the idea to do the same thing. We could see a bunch of lawsuits against all the drug companies that made the COVID vaccines, and that could really scare companies away from investing in new vaccines.
So, like, they'd be afraid of getting sued later on, even if they're trying to help people. That could be a huge problem for public health.
Exactly. It could create a whole climate of fear and uncertainty, making it much harder to respond quickly and effectively to the next pandemic.
But wouldn't more scrutiny also lead to safer vaccines and more transparency? Isn't that a good thing?
There are definitely potential benefits. More oversight could lead to better safety testing, more transparency in clinical trials, and clearer communication about the potential risks and benefits of vaccines.
So it's like a double-edged sword. More oversight could make things safer, but it could also slow down progress. How do we find the right balance?
That's the big question. We need rules and regulations that ensure safety and accountability without stopping scientific progress. And this case could actually force us to have a conversation about how to do that.
And it's not just about regulations, right? This case also brings up the whole issue of public trust, which is super important for anything to do with public health.
Absolutely. Trust is the foundation of public health. If people don't trust the science, the institutions, or the companies making vaccines, it's going to be really hard to get everyone vaccinated.
And this lawsuit is happening at a time when there's already a lot of distrust out there, with all the misinformation and conspiracy theories going around. The valuetainment discussion really gets into that, suggesting there might be a deliberate effort to manipulate public opinion.
Right. The host talks about this idea of a coordinated campaign to create the problem, sell the solution. It's a serious allegation, and again, we're not saying it's true.
Right. It's really important to emphasize that. But it is a perspective that some people believe, and it's important to understand why. There's this feeling that maybe some powerful groups actually benefited from the pandemic. Whether that's true or not, the fact that people think that way is already causing damage.
Absolutely. And that's what makes this case so important. It goes beyond just the legal stuff and the scientific evidence. It's about the fact that people are losing trust in the very institutions that are supposed to keep us healthy and safe.
So you're saying that even if Pfizer wins, the damage might already be done?
It's definitely possible. Even if Pfizer is completely cleared, those doubts are still out there. And rebuilding trust is much harder than keeping it in the first place.
Yeah, it's like trying to put toothpaste back in the tube once it's out. And that's kind of scary when you're talking about something as important as public health.
It's a serious issue, and it highlights how important it is to have more transparency, open communication, and a real effort to rebuild trust between institutions, companies, and the public.
So what can we do? Is there any way to fix this lack of trust?
It's not an easy fix, but I think the first step is just acknowledging that the problem exists.
Mm.
We need to have open and honest discussions about the role of pharmaceutical companies, how money influences politics, and how misinformation spreads.
It's like we need some kind of giant therapy session for society to deal with all this stuff.
That's a good way to put it. We need to create safe spaces where people can have these difficult conversations, disagree respectfully, and try to find common ground.
And it's important to include different perspectives in these conversations. We can't just shut down people who disagree with us or call them conspiracy theorists. We need to actually listen to them, try to understand where they're coming from, and address the anxieties that are driving these beliefs.
I agree. It's about finding ways to bridge the gap, rebuild trust, and create a shared understanding of the challenges we're facing. Because at the end of the day, we're all in this together. The pandemic has shown us just how interconnected our health really is. What happens to one person affects everyone.
Yeah, that's a really important point. So as we wrap up this part of our deep dive, I want to leave our listeners with this thought. This lawsuit is just one small part of a much bigger problem. It's a symptom of a deeper issue in society, a crisis of trust that goes way beyond vaccines and pharmaceuticals.
We have to address the root causes of this distrust. We need to find ways to restore people's faith in our institutions, in science, and in each other. Because without trust, we can't effectively tackle the big problems we're facing as a society, whether it's pandemic, climate change, or any other threat.
This is a conversation that needs to continue. We'll be right back to finish up our deep dive and explore some possible ways forward. All right, welcome back to the deep dive.
So we've been looking at this Kansas lawsuit against Pfizer, and yeah, it's definitely raised more questions than answers.
Yeah, we've been through a lot, haven't we? All these legal arguments and scientific data, even some, pretty wild theories. But I think what this really shows is how divided we are as a society.
It does feel like we're at some kind of crossroads. We've seen how this distrust can really hurt public health, but we've also seen how it could lead to positive changes, like more transparency, better rules, and a real effort to rebuild trust. So where do we go from here?
Well, it's hard to say for sure, but I think it starts with us taking action, being informed.
Yeah.
We can't just sit back and listen to everything we hear. We have to really think critically about the information we're getting, look for different perspectives, and have respectful conversations, even with people we disagree with. Yeah, it's like we all need to become our own little scientists, right?
Yes.
Carefully looking at the evidence and making up our own minds.
Yeah.
But it's not just about what individuals do, is it?
No, definitely not. We need to change the system, too. This case shows that we need stronger regulations, more transparency from these big pharmaceutical companies, and a real focus on getting the public to trust institutions again.
So basically, we need to overhaul the whole system. That's a huge task.
It might seem that way, but it's important. We need to demand more from our leaders, from the agencies that are supposed to regulate things, and from the companies that make the medications we depend on.
Yeah, it's like we need to hold their feet to the fire and say, hey, we need you to do better. We need a system that puts public health first, one that's transparent and accountable.
Exactly. And that means we have to be active citizens. We need to vote, support policies that align with our values, and make sure the people in power are doing their jobs.
So this whole deep dive, it's not just about understanding one lawsuit. It's about understanding the power we have to shape the future of public health.
Yeah, it's about realizing that we're not just watching from the sidelines. We can actually make a difference.
This whole conversation has been a wild ride. We had those shocking claims in the lawsuit, then those kind of unsettling ideas from the valuetainment discussion. It's a lot to take in, but honestly, I think I'm feeling cautiously optimistic. There are big challenges ahead, but this could be a chance to make some real positive changes.
I agree. This case has brought to light some serious problems, but it's also started a conversation that we should have had a long time ago. And that conversation could lead to a better future for public health, one that's more transparent, fair, and equitable.
So as we wrap up this deep dive, I want to leave everyone with this one thought. We've looked at all the angles of this case, the different sides of the story, and the possible ways forward. But the real question is, what role are WE going to play in shaping the future of public health?
Are we going to sit back and watch? Or are we going to step up and make a change? The choice is ours.
Thanks for joining us on the deep dive. Until next time, stay curious, stay informed, and most importantly, stay involved.